I think I was also somewhat concerned about where the stem cells were coming from because I do know several local practitioners here in the Torrance area that harvest stem cells, but they harvest them autologously from our own bodies. In other words, I would be taking my own stem cells out of my hip, for instance, through bone marrow aspiration, and then harvesting the cells that way, cleaning them up, and then being able to actually re-inject them in. That's a very common practice here in the South Bay. I know a few pain management doctors that do that with really good effect. So it was a concern for me initially, but after sitting down with Dr. Hawkins and the nurse practitioner Joey and reviewing the information regarding where the stem cells come from, they come from they come from fetal cord blood, and they're harvested after a pregnancy, for instance. They're taken to a lab in the U.S. and they're washed and rinsed and sterilized, and then they're allowed to multiply so they can be used for this purpose. And so after reviewing that information and having it as transparent as possible, I felt much more comfortable with this option. Yes, you are injecting something foreign into your system, but it's something that is about as clean as possible in terms of the actual usefulness of the stem cells. So that became less of a concern. And here we are 5 months later, and I'm having a heck of a lot less pain than previously, to the point where I'm pretty much walking now, 2 or 3 miles every morning, which I couldn't do before. And that's honest. I mean, it really was limiting in terms of physical activity. So I think that this way of doing things going forward is going to be very, very good for patients.